Hello, everyone. Happy Thursday. My name is Shalaya Yazdi. I'm a public health practitioner and a Master's of Medical Health Science student at Touro University. Since the pandemic began, people around the world experienced a shift from their normal routines. These limitations can make it difficult to balance positivity, productivity, and self-care. So my mentor, Dr. Jay Shubrook, and I created this webinar series to share wellness tools with our community. During our first week, we had the pleasure of learning about how food can contribute to our wellness and how certain foods can mitigate the onset of inflammation. Last week, we discussed how to integrate movement and learned about various stress management techniques. We also learned how we could optimize our mind, body, and spirit, how to find balance between the three, and why this makes a difference in our overall well-being. The third week, this week, began with a discussion about chronic condition awareness and reducing stigma. Yesterday, we discussed prevention. It's not too late to take action, and there are many resources that Touro University offers throughout every level of prevention. Today, we will highlight how mental health and chronic conditions are related and also discuss the mental health disparities that people of color may face. Join us before Thanksgiving, where we will talk about how to make the best of the 2020 holiday season. Our last session will incorporate all the highlights throughout the month of November, and we will discuss how we can make sustainable adjustments to our habits given such busy schedules. All webinars are recorded and will be posted on our website at tu.edu/mobec/Zoom into Wellness. I would like to introduce our guest speaker, Kirbee Brooks, who is a public health practitioner and a senior health education specialist with Solano County Public Health. I would also like to introduce Myrna Denial, who is a Master's of Medical Health Science student at Touro University. Myrna is a public health advocate and a mental health advocate as well. So thank you all for coming tonight. Please use the Q&A tab to ask us any questions. They will be addressed at the middle of the presentation and at the end as well. So thank you all for coming. Let's zoom into wellness with Kirbee Brooks and Myrna Denial.
Good evening, everyone. Thank you so much for having me on. I'm just going to go ahead and get set up here. Just give me a couple of moments so I can share my screen. Everyone see my screen? Are we good to go? Okay, so good evening and thank you all for tuning in with us. My name is Kirbee Brooks, and today I want to talk to you about mental health and chronic condition management. My background with Solano Public Health is in chronic disease prevention, so I want to talk about how chronic diseases can impact one's mental health and why it's important to prevent and/or manage chronic disease. So today we're going to cover what is chronic disease, how does chronic disease impact mental health disparities among communities of color, and 5 tips to take control of chronic conditions. Chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living, or both. Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. Many chronic diseases are caused by a short list of risk behaviors, such as tobacco use and exposure to secondhand smoke, poor nutrition, lack of physical activity, and excessive alcohol use. It's important to note that many chronic diseases are preventable. with a balanced and healthy lifestyle. The increase of the chronic disease, diabetes, has become an epidemic. Yes, I know it's really scary right now to think about or hear about an epidemic in the midst of a pandemic, but it's true. While diabetes mortality is rising for all race and income groups, complications and higher death rates occur particularly among minorities and low-income groups, thus exacerbating health disparities. Diabetes is epidemic. The high and rapidly increasing prevalence of the disease demands this description. Over 55% of Californians right now either have diabetes or pre-diabetes. And so that is definitely something to be concerned about. It's a chronic disease to be concerned about. In Solano, rates of pre-diabetes are on the rise. With new or existing diagnoses of pre-diabetes or diabetes, people in our communities are often frightened and view diabetes as a death sentence. But I have news for you. It's not true. Diabetes does not have to be a death sentence. Diabetes or type 2 diabetes can be prevented in people with pre-diabetes, and a person with diabetes can also live a long, healthy life with controlled disease. So this is all possible, again, with healthy lifestyle changes. So this is a snip from the Solano County 2020 Community Health Needs Assessment. The official report has not been released yet, but I want to share this data with you. Solano County is surpassing the state average for youth obesity rates and the percent of population that experiences food insecurity. This is not surprising, being that we have many food deserts, especially in the city of Vallejo, where some communities in particular have a lack of access to fresh foods. So what's even more alarming about this data is that the disparities that exist among the various racial groups. So our Hispanic, Asian, and Black populations have particularly high rates of stroke-related deaths. Youth obesity rates are the highest among Hispanic, Native American, and Black populations, and adult obesity rates are at an alarming high. This type of information is important for us to know to understand part of the reason for increases in chronic diseases in our community, and to help better understand how social determinants of health impact these health disparities. Whew. So are you feeling overwhelmed yet? Take a deep breath. With this type of information, it's not hard to see how chronic disease can weigh on one's mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental health disorders such as major depression, bipolar disorder, obsessive compulsive disorder, and post-traumatic stress disorder are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning. They are medical conditions that often result in a reduced ability to cope with routine daily activities, such as going to work or raising a family, gardening, or even hiking. It is common and understandable for a person to feel sad or discouraged after a new diagnosis, a heart attack, or managing a chronic pain condition. Temporary feelings of sadness are expected, but if these feelings or other symptoms last longer than a couple of weeks, you may be experiencing depression. Depression affects your ability to carry on with daily life and to enjoy work, leisure, friends, and family. The health effects of depression go beyond your mood. Depression is a serious mental health illness with many symptoms, including physical ones. And some of these symptoms of depression are are feeling sad, irritable, anxious, feeling empathy or hopeless, maybe even guilty or worthless, a loss of pleasure in usually enjoyable hobbies or activities, fatigue and decreased energy, feeling listless, trouble concentrating, remembering details and making decisions can become difficult, not being able to sleep or sleeping too much or waking up way too early, eating too much or not wanting to eat at all, possibly with unplanned weight gain or weight loss, thoughts of death, suicide, or suicidal attempts, or even aches and pains, headaches, cramps, or digestive problems with a clear physical cause, without a clear physical cause, and that do not ease with treatment. So just like chronic diseases, mental health disorders are treatable. So remember that, just like chronic diseases, mental health disorders are treatable. Most people diagnosed with a serious mental health disorder can receive relief from their symptoms by following a treatment plan specifically designed for them by a trained psychologist or psychiatrist. So people with medical conditions have a higher risk for depression. The same factors that increase risk of depression in otherwise healthy people also raise the risk in people with other medical illnesses. Maybe even more so, since having a chronic disease is a risk factor for depression or a mental health disorder. So if you take a look at the chart here, we can see that some of the risk factors for mental health include your family history, stressful life conditions, having a chronic disease, like we just talked about, right? A traumatic experience, use of illegal drugs, child abuse or neglect, or lack of social support. And here, if you notice in the chronic disease section that we are listing modifiable and non-modifiable risk factors, which include for non-modifiable or modifiable, poor eating habits, lack of physical activity, tobacco use, excessive alcohol use, environmental factors, socioeconomic status. And some things that we can't change for our risk factors include our age and our family history. So again, note the modifiable risk factors. A lot of those things we can achieve with a healthy lifestyle, and we can work to prevent chronic disease through those modifiable risk factors, okay? It's also important to note that while people with chronic disease, with chronic medical conditions have a higher risk of depression, people with depression have a higher risk of other medical conditions. Individuals with depression have an increased risk of cardiovascular disease, diabetes, stroke, and Alzheimer's disease, to name a few. Research suggests that people with depression are at a higher risk for osteoporosis relative to others. The reasons are not clear yet, but one factor with some of these illnesses is that many people with depression may have less access to good medical care. They may have a harder time caring for their health. For example, seeking care, taking prescribed medications, eating well, and exercising. We're going to talk more about the mental health disparities in a few moments. But again, depression and other mental health conditions are treatable even when other illnesses are present. Later in the presentation, we'll talk about 5 tips to manage mental health and chronic conditions. So the American Psychiatric Association highlights other mental health disparities, such as 1 in 3 African Americans who need mental health care receives it. So only 1 in 3 African Americans who need mental health receives it, which may be due to barriers such as distrust of healthcare systems and stigma. Nationwide, approximately 11% of African Americans lack health coverage compared to 7% of non-Hispanic whites. African Americans with any mental illness have lower rates of any mental health service use, including prescription medications and outpatient services, but higher use of inpatient services. Minority populations have deeply rooted historical and generational trauma, which continues to impact the social issues they experience in our communities today, including mental health. Compared with the general population, African Americans are less likely to be offered either evidence-based medication therapy or psychotherapy. Only 8% of Asian Americans seek mental health care, compared to 18% of the general population. Stigma may also play an important role in one's willingness to access care among the Asian community. Hispanics are more likely to report poor communication with healthcare providers. American Indians and Alaska Native children and adolescents have the highest rates of lifetime major depressive episodes, About 1 in 10 Hispanics with mental health disorders use mental health services from a general healthcare provider, while only 1 in 20 receive such services from a mental health specialist. So they receive their mental health services from a general healthcare provider instead of a mental health specialist, which could mean they're maybe not getting adequate care or the proper diagnosis. Nationally, 21.1% of Hispanics are uninsured, compared with 7.5% of white non-Hispanic Americans. In 2018, the California Self-Sufficiency Fact Sheet identifies self-sufficiency as the minimum income necessary to cover an individual or family's basic expenses, such as housing, food, healthcare, childcare, transportation, and taxes, without public or private assistance. The reason for sharing this information is for you to understand, although this county is extremely diverse, and we're talking about Solano County here, is extremely diverse, there are significant racial disparities here, just as we see similar trends throughout the state and nation. As of 2018, nearly 40% of African Americans, Latinx, and Native Americans did not earn enough income to cover their basic needs, which is double the amount for the Asian and Pacific Islander and white communities here in Solano County. These disparities reflect the many barriers that different groups experience in our communities. These inequities make it more difficult for people struggling with mental health symptoms and chronic diseases. These disparities did not happen overnight, and many scholars and activists suggest they are directly linked to the historical legacies of racism, genocide, and exploitation, which has produced generational trauma for our communities today. The COVID-19 pandemic. The COVID-19 pandemic has also increased awareness of some of the co-occurring health disparities African Americans experience, who have been disproportionately dying after contracting COVID-19, contracting this disease in comparison to other groups. The graph shown here highlights data by how many African Americans populate each city by how many are dying due to the deadly virus. For example, in Louisiana, African Americans represent 32% of the state population, but are 70% of the COVID deaths. Many counties have proclaimed racism as a public health crisis that has contributed to these disparities due to the everyday environmental stressors minority groups are exposed to in our society, which leads to poor health outcomes. And it's been proven that chronic stress can lead to chronic conditions such as diabetes, hypertension, heart disease. And again, we're making that connection right now with mental health and how that's linked to mental health. Unfortunately, these trends are also represented in our local data here in Solano. According to our county public health dashboard, as you can see a slide here of that data, this data is from the dashboard, the COVID dashboard, which is updated daily during the week at 6 p.m. If you can see here from the chart, Black and Asian people are disproportionately impacted by the coronavirus here in Solano County in comparison to other groups. Blacks make up 14% of the population, but are 24% of the deaths, and Asians make up 14% of the population as well, but are 19% of the deaths. So those there's two significant disparities here from the populations and the percent that they represent in the population to the amount, the death rate of those groups due to COVID-19. So this slide demonstrates rates of COVID positive cases by race and ethnicity based on the population of Solano County. So Latino and multiracial populations have disproportionately contracted this disease in this county, which is also a similar trend we see throughout the state. It's also important to note that we do not currently have any local data that separates the impact of COVID specifically on Native Indigenous people, but our public health officials included these groups along with other multiracial category groups, which we know continue to experience many hardships in our society today, which also leads to poor health outcomes. And this slide just shows the rates of COVID-19 by city of residence in Solano. And you can see here that Fairfield, Vallejo, and then Vacaville are leading in the number of COVID cases. Now, how has this pandemic impacted our mental health as a society? The Washington Post recently published an article that highlighted data from the CDC that demonstrated an increased prevalence of mental health anxiety and depression symptoms, such as excessive worrying, fear, trouble sleeping, and feelings of worthlessness, which have tripled since 2019 here in the US among all racial and ethnic groups. However, just as the disparities mentioned in my previous slides, this graph shows how Black and Latino populations have increased the most, especially as we see the disparities in the contraction and death rate of the coronavirus, which has disproportionately impacted Black and Brown communities more than the general population, both nationally and locally. So that's important to know. It's also important to keep in mind the challenges these groups experience simultaneously, such as fears of deportation or the traumas of family members and loved ones being locked into detention centers, the continued exploitation of native land, and hardships many people are experiencing during these challenging times. This graph was taken from a recent article with the Washington Post again, which highlights how injustices can negatively impact our mental health by increasing symptoms such as depression and anxiety. Since the video of George Floyd's murder was released, the Black and Asian communities saw significant spikes in their mental health symptoms. I must also reference the increased hate crimes targeting the Asian community members, which existed before the pandemic, but has also been increasing since the pandemic began. My intention for showing this data is to highlight how these types of traumatic events can negatively impact our mental and physical wellness. Frequent exposure to acts of violence, discrimination, abuse, and other forms of hatred are some of the driving forces for health disparities. So I know that I've discussed a lot and given you all a lot of information. So I want to pause for a moment to let everything we've talked about chronic disease, mental health, the disparities that exist. And I want to see if there are any questions that you all have. So what questions do you have for me? And do we currently have any questions in the chat box, Myrna?
So there are no questions right now from participants.
Okay. I'll wait a couple more seconds to see if anyone has questions. And we'll have time again for questions at the conclusion of the presentation.
We just got a great question from participants. So they were asking, how do we break the cycle of bias?
That's a really good question. And I think it's going to really be a collaborative effort among multidisciplinary groups coming together and really putting together cultural competency training. We have to learn cultural humility and just have a better understanding and appreciation and acceptance for other cultures. And so I know Solano County, we're doing a lot of equity work. We have an internal equity collaborative where we're focusing on how we can better serve our community and being aware and abreast of the different cultures and backgrounds that exist in Solano County, because we have a really diverse community. And so I think it takes opening your heart and really being open to learning and having training in places where training doesn't exist, having these conversations in places where these conversations don't exist. We have to learn to get uncomfortable to change our biases about other people? Thank you for that question. That was a great question. Are there any more questions?
Not at the moment.
Okay, thank you, Myrna. Okay, well, we're gonna go ahead and move on. If you have questions as we go through the presentation, feel free to pop them in the chat box, or if you wanna write them down and save them to the end. We love to take your questions. And no question is a bad question. And I just wanna let you all know this is a safer space. And if you have particular questions about the health disparities, and I know we're talking about some heavy stuff and trauma and racism and things that cause or lead to health disparities. So feel free to ask those type of questions, or you can email me separately after this webinar to ask questions as well. All right, we're gonna go ahead and move on. So in the 2020 Solano Community Health Needs Assessment, the Solano community identified behavioral health as the 6th top priority for Solano residents. Behavioral health is a foundation for a healthy living and encompasses mental illness, substance use and overdose, and access to service providers to prevent, care, and treatment. And I think I mentioned earlier in the presentation that the 2020 Community Health Needs Assessment has not yet been released to the public, but I thought for this presentation it's really important to share this with you. And I'll go on to the next slide. Healthy eating and active living was identified as the 7th health priority. Healthy eating, active living, also referred to as HEAL, H-E-A-L, relates to Solano County's residents' ability to shape their health outcomes through nutrition and physical activity. And so this is the 7th priority that the community ranked through a vigorous community health needs assessment process. 7 out of 8 total priorities that were identified in total. So again, I'm highlighting these priorities in this presentation because they directly impact chronic disease and mental health outcomes for our community. I want to ensure you that Solano Public Health is taking action to cultivate healthier communities and achieve health equity through policy, programs, and systems change. And we're bringing our community along with us in this process. So we've worked with a lot of partners in Solano Public Health to really create this culture of health in Solano. And Touro University, California has been an excellent partner in helping us to implement the diabetes prevention program, the Mobile Diabetes Education Center, MOBEC, as we all know, who services the most vulnerable communities in Solano. So again, all of this is very important when we think about our community's needs and then the priorities that our community has identified: behavioral health and healthy eating, active living. So with all of the health disparities, social injustices, and traumatic experiences we are living in right now, it's really important that we focus on resilience. The American Psychological Association, the American Psychological Association defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Some examples could be racism, discrimination, microaggressions, family and/or relationship issues, poverty, chronic health conditions, etc. Although resilience is a form of survival and self-perseverance, it does not always indicate optimal health and functioning. And so at Solano Public Health, our hope is to transition our community from a place of surviving to a place of thriving. So now we're going to talk about 5 tips to take charge of chronic conditions. So first, you can start by engaging in regular physical activity. Find a physical activity that you enjoy and make it part of your daily routine. The CDC recommends 150 minutes of physical activity per week for health maintenance, but 300 minutes per week for optimal health benefits. This does not have to be done all at one time. You can split up this time throughout several days throughout the week. Next, maintain a healthy, balanced diet with fruit and vegetables and whole grains. Try to eat mostly whole, fresh foods, meaning foods that do not typically come in a package. Read the nutrition labels for foods that do come in packages and focus on the serving size and be mindful of how many servings you're eating and the calories that you're consuming. Get support. When dealing with a chronic disease and or a mental health disorder, it's important to get support from a trusted individual or peer support group. Identify someone you love or trust to be a support system for you in the midst of dealing with your chronic condition. Seek treatment. Treatment is crucial when you're dealing with a chronic disease or mental health disorder. Talk to your healthcare provider or mental health specialist about your treatment options. When dealing with mental health issues, sometimes it's difficult to remember to take medications. Remember we talked about it may be difficult for folks with mental health issues to seek care or to even identify support. But this is where your support will really come in, your support system comes in. And we can try different tips or use reminders such as setting an alarm to take your medications or to make sure you're making your appointments. But treatment is very crucial when you're dealing with a mental health or chronic disease. And number 5, use local resources. Identify local resources and use them, okay? So there's a lot of local resources in Solano, and I try as much as I can to share that information with our community because we want you to use them. They're there for you, and we want you to have access to them because we truly believe that it can help improve your health outcomes for our community. So identify local resources and use them. We have a lot of resources here in Solano to help people dealing with chronic disease and our mental health issues. And so in the next few slides, I want to share a few local resources with you. Touro University, California, and Solano Public Health are proud to offer the National Diabetes Prevention Program to Solano residents at no cost. This evidence-based program is for people who have been diagnosed with prediabetes and are ready to do the work to prevent T2. Solano Public Health is partnering with the county library system to offer Just Check It, which is a blood pressure self-monitoring program. So we provide blood pressure kits for community members to borrow from the library, just like they would a book. So check your blood pressure at home, write down your numbers, and share them with your healthcare provider. The mobile food pharmacy that you can see here in this picture provides fresh produce and food boxes to people with a prescription from their healthcare provider, which usually is from one of our county clinics. Anyone can receive produce from the food pharmacy, and the dry foods are usually for patients with a food prescription. This is an effort to increase access to healthy foods in Solano. The Park Prescription Program was designed to promote health in the outdoors. Research shows that spending time in nature can improve one's physical and mental health. So through the Park Prescription Program, community members are given a prescription to visit one of Solano's many outdoor green spaces. And as you can see here from the picture on the far left, this is one of our mock park prescription pads that we use. And we give community members a park's prescription to experience health in the outdoors. So these are just a couple of the resources that are available to our residents at no charge. You can participate in the evidence-based diabetes prevention program. You can borrow a blood pressure kit from the library and take it home with you for weeks at a time and monitor your blood pressure and share your results with your healthcare provider. You can visit the mobile food pharmacy at various locations across Solano County and get some free produce or dry foods. And you can participate in the Parks Prescription Program and visit one of our many green outdoor spaces which is really the good place to be now in this pandemic, is outdoors. And I know it's getting cool, but find as much time as you can to experience health in the outdoors, because it is good for your physical and your mental health. And also here, I wanted to share some of our county behavioral health resources. I've listed here the call centers, the access line. You can call to request services for mental health and or substance use services. The county serves community members who have Medi-Cal or are uninsured. There's also a behavioral health COVID warm line, which some people may not have known about. But this one is for anyone who may be experiencing stress, anxiety, and or feelings of depression while dealing with the daily struggles and disruptions in our lives due to COVID-19. A therapist is ready to listen and offer support, suggestions, and referrals to appropriate resources. There's also the public health COVID warm line. This line is for anyone who may have general questions about COVID-19. And then I listed here crisis support, the National Suicide Prevention Lifeline, the Crisis Text Line, the Trevor Project, which is crisis intervention and suicide prevention for lesbian, gay, bisexual, transgender, and questioning youth ages 25 and under. And the Crisis Stabilization Unit is an acute facility for individuals experiencing a mental health crisis, suicidal or homicidal thoughts, gravely disabled to stabilize. So I just want to mention that the Crisis Stabilization Unit is not a crisis line. And Solano County Behavioral Health has undergone some changes to work towards achieving health, has undergone some changes to work towards achieving health equity and eliminating health disparities in Solano. These changes include using data to drive efforts, changes to hiring and policies, and collaboration with law enforcement to serve as a designated law enforcement liaison. So those are some of the things Solano County Behavioral Health has been focusing on to ensure that their services are equitable, they're inclusive, and that they're partnering with our local law enforcement to offer support to handle crisis, behavioral health crisis or mental health crisis. This is my pretty page of references, if any of you all are interested. And we're gonna pause again for questions. So we covered a lot today about chronic disease and mental health. And so I know you have to have questions.
So there are a few questions from our participants. The first one is there any effort in Solano County to attend to community members with separate chronic conditions currently living together in public housing and where particular needs are not being met, for example, nutrition, stress, mental disorders, drug abuse, elderly living, diabetes, transitional public housing for people with diabetes over 50, limited income, homelessness, and etc.
I'm sorry, can you repeat the first part of the question? Is there any work in Solano being done?
Yes, so it asks, is there any effort in Solano County to attend to those community members with the different chronic conditions and all of the other listed conditions?
Yes, there is. Actually, that we have what we call a coalition. It's called the Healthy Solano Collaborative that focuses on many different aspects or social determinants of health, of things that impact the community's health. And so there's different work groups that focus on things like chronic disease, education, poverty, and the list goes on. And so that group is actively working on how to address different health issues in Solano County. And actually that's the group that took the lead on this community health needs assessment. And the assessment data is not out yet, but the plan is once the information comes out, they're going to start implementing or developing a plan for implementation to address each of the community's identified priorities, which I believe fits into the list of health issues that you mentioned in your question.
Another
Question.
Another great question was, is there a diabetes crisis unit in Solano County?
Is there a diabetes crisis unit in Solano County? That's a really good question. That's actually probably a Dr. Schubert question. That's actually probably a Dr. Schubert question. I'm not 100% sure, but we can definitely find that information out and share it with the group. Unless Dr. Schubert, no, shaking his head, no, okay.
No, not at this time, but it's a good idea.
Yeah, that's true. So yes, not at this time, but thank you for bringing that up. That's something to keep in mind as we work on, implementing this community health needs assessment. A plan for the community health needs assessment.
Okay. Another excellent question we have here. So someone said, I think a lot of people feel more isolated than ever with COVID. People are afraid to seek care. How do we provide information where people can get mental health care?
I would definitely say to call into the behavioral health COVID warm line. In public health and just the county in general, we've all kind of been reverted from our daily jobs to really focus on the health of our community in regards to COVID. So there are designated therapists and behavioral health staff who have set aside time to talk with our community members on this warm line and provide relevant resources for their needs. And even just, to have someone to talk to. And so I can send out to this group or send out attachments that we can send to the participants later about different behavioral health resources that are in Solano that we can share with people that we know who may benefit from it most.
That was the last question we have from our participants.
Okay. And is there anyone else? Any other questions? We still got time. Well, I want to thank you all for joining on here with us today. And I'd love to invite you to participate in the Solano County Healthy Solano Collaborative. Again, it's a work group of individuals or different agencies or entities that are coming together who are now going to start to build an implementation plan for this community health needs assessment.
Kirbee, thank you so much. I think you've brought out really a lot of important points, and I really appreciate your efforts. I do have a couple questions for you just because I want to make sure that the community knows some of the resources. Could you tell us a little bit about Vibe Solano?
Yes. Actually, Vibe Solano is another work group that branches from our Health Promotion Community Wellness Bureau of Public Health. In Vibe Solano, they focus on chronic disease prevention specifically. So that's where the Parks prescription program lies that I mentioned to you. We have the Solano Moves work group that is a subcommittee group of the Vibe Solano Alliance work group. And then there's also Oral Health Committee, Solano Oral Health Committee that focuses on oral health in Solano County. That's a part of the Vibe Solano Alliance. And we're also starting to do more work around health and all policies. And so that work group has been a little quiet lately, but we're hoping to get up and running at the top of the year. So yes, the Vibe Solano Alliance is a work group or as a coalition focusing on chronic disease prevention in Solano. And so that's actually another great resource to answer someone's question. So thank you, Dr. Schubert, for bringing that up.
And so I heard that there are a lot of work groups and there are a lot of people who have a lot of opinions and they have a lot of interest. Let's say someone wants to be involved. How do they get involved? And, I certainly know that Solano County Public Health has pretty much been very open to community and partnership engagement. So what's the first step?
The first step is to reach out to a local organization. You can reach out to me in Solano Public Health. You can reach out to contacts at Touro University or any other local community organization and see what they're currently doing in the community. If you reach out to me, I have direct connections to many organizations or different ways to get involved in Solano. I'm also the project coordinator for the Solano Tobacco Prevention and Education Program, where we focus on policy change to reduce tobacco use and secondhand smoke exposure. So there's so many ways to get involved. So I would just encourage you to seek out your local health department, seek out your local universities like Touro and other community groups in your area. I know in Vallejo, there's several groups doing some great stuff there. And I'd be happy to put you all in contact if anyone's interested. And I have my contact information right here is my email address. Feel free to email me.
Would you be willing to put in the chat the link to Vibe Solano and Healthy Solano Collaborative?
Sure.
So while Kirbee is doing that, I want to thank Myrna. I want to thank Kirbee and so of course Shalaya, who's been working diligently this month to coordinate these events for making this happen tonight. We really appreciate your expertise and your involvement. I do want to remind everyone, one of these partnerships, just as to be case in point, between Solano County Public Health, Touro University, Mobic, Sutter, Solano, and Walgreens will be having 3 free flu clinics this weekend. We're all worried about you getting COVID over Thanksgiving, and we want you to socially distance and take care of yourselves, and we want to make sure you don't get flu. So if you've not gotten your flu shot, we have 3 drive-through events this weekend. I've put the link in the chat, and anyone that wants it can get it, and it's a pretty quick process, and we want to make sure you're protected. There are lots of things in the community that are available for you. We want your involvement and we want your voice. What I love about Solano County is our diversity. And I also know that we're a pretty robust community. I think we've got some challenges, but we don't shy away from these challenges. We go at them. And so I think this is a chance for us to contribute to some solutions, So thank you. I want to remind everyone that we do have more sessions coming up. So next week, Ann Lee will be talking about staying healthy for the holidays. And then the following Monday, Shalaya and her team will be talking about putting it all together and taking charge of your health moving forward. The feedback has been wonderful. Please share this with your friends and families, and we'd like to see you zooming into wellness next week. Thank you so much.